Mental health needs continue to climb across Chicago, and access to care is a huge barrier, especially for those who are uninsured or underinsured. Local nonprofit Trilogy is responding by increasing access to mental health care in areas that have high needs.
President and CEO Susan Doig joins us now to share more. Thank you for coming in.
Thanks for having me.
I would have to say congratulations on the opening of your new spot, but it just speaks to how important it is to have these services in the city, and even more is needed.
Absolutely. More services are needed. And Trilogy's, so we're a community mental health center. We serve mostly people who have Medicaid or folks who are underinsured or don't have insurance at all. And so those are particularly, those folks have a harder time finding service. And what the data shows us in Chicago and across the nation is the people who need the service the most have the most trouble accessing service. So we are growing to meet the needs in the city of Chicago, for sure.
Where are the needs the greatest?
Well, I can talk about a couple of things. So Trilogy has been on the northeast side in Rogers Park for over 50 years. We just opened a new space about 50 blocks west in the northwest part of the city. And that part of the city hasn't had enough services that are comprehensive, like Trilogy's services are. So part of what we do is, what you think about traditionally as mental health care is, talk therapy and psychiatry. We do those things, but we also, about 60% of what we do is intensive outreach services. So that we have teams of folks who are going out into the community, they're meeting clients in their apartments, they're taking people to doctor's appointments, the pharmacy, making sure that people have the things that they need to live meaningful, independent lives. And so for someone who has a diagnosis like schizophrenia, sitting in an office for an hour a week doesn't cut it. It doesn't really give you all of the things that you really need to be successful in the community. And so that's what we do.
And you've expanded it to include teens now, right?
Right. We serve children, adolescents, families, and adults with more serious mental illness.
You talked about outreach. It's my understanding, correct me if I'm wrong, there are a lot of people out there who could use mental health services that don't either know about it or don't necessarily want to get it. How do you guys get to those folks?
Exactly. Well, so about 20% of our workforce are people who have lived experience themselves, meaning they are consumers of mental health service. And that is one way to really break down stigma, because you can meet with someone and they can say, hey, yes, I had a hard time, taking the step to get help myself, taking medication, and those, that can really help people make the decision to get into care. And I think some of the, meeting people really, literally where they're at is also really helpful. We help our employees to really know how best to establish rapport with people and build trust, which can be hard and time-consuming.
Yeah.
One quick question I had a thought about. A lot of people, you say, are uninsured or underinsured. How do they get access to medication? Do you help them to get those medications? Because those cost money, and they can be expensive, I imagine.
Oh, yes.
Especially if it's continuous.
Oh, yes, absolutely. So we have grant money, actually, for behavioral health medications. We work with pharmacies, and we have federally qualified health center partners. So one of the programs that we offer is integrated behavioral and primary care. So all under one roof. It works so much better, right? When our doctors get to talk to each other. And particularly with people who have, higher rates of co-occurring medical disorders, it's even more important. And with that, there are discounted pharmacy rates. We help people pay for a lot of that, frankly. I mean, that's where, private dollars come in handy, because, you can't go without medication.
Right.
You can't.
No, right. So, unbelievable.
And you're hiring, right?
Oh, yes. With all of the growth that we're experiencing, we are hiring. Trilogy is a great place to work. We have a great work culture. We like people to come in and stay and grow. So we are looking for mission-minded people to help us expand services.
Amazing.
Fantastic,
Susan, thank you for coming in and joining us and telling us more about Trilogy. For more information, visit trilogyinc.org or give them a call, or you can follow them on Facebook and Instagram at the handles you see there on your screen.